welcome to Tipsy Tooth Talk. I'm Dr. Carlin Palmer Bloom.
And I'm Dr. Michelle Bishop, and I call it TQ because I cannot say it.
So Happy New Year!
Happy New Year! Welcome to 2022! It's January.
Yes. So Michelle had a great idea about what we should do for our first beverage for 2022.
Yes. So it's kind of trending right now. If you've been seeing things online, or even this morning, I got up and I was like, "Is someone punking me? Do I have a just recorder in my house? Like, what's going on?" Why is it was on Good Morning America talking about mocktails, right? Because we've all kind of overindulged just a tad over the holidays, and so a lot of people
just a tad.
Okay.
Or a lot.
Or a lot. Whatever. A lot of people like to do dry January. Okay, well, some people like to do, this is for you, some people who like to do dry January. So we are going to do a mocktail margarita. So I'm going to be honest, we always say these are one take wonders. I did taste test this one just because I just had to see. And it's very, very close. And there's a weird ingredient that kind of gives it that funky tequila vibe.
Oh.
So, okay.
Awesome. And then what are we going to talk about for teeth?
Oh yeah, teeth. Ah. So
we have the tipsy, not tipsy this time.
Yes, untipsy tooth talk today. So if you're living anywhere right now that has any type of pollen blowing, and God forbid you live in Texas at the moment, because we are all dealing with cedar fever, me in particular. So as we take medications and things, we all end up with dry mouth. And so we're going to talk a little bit about dry mouth, why it happens, and what you can do to help get through it.
Yeah.
Yeah. Cedar. Woo. Somebody God, why? Why? What purpose does cedar, somebody should Google that for me. What purpose does cedar have? Does it serve a purpose?
I don't know. I mean, there's trees.
Other than to make me sneeze, make my eyes feel like they're going to bulge out of my head, make my head feel like it's full of pressure.
Make me worry that I have COVID.
Oh, yes. Yes. I've already tested twice for that because I was worried about it as I was sneezing. But here's what one nurse told me. COVID usually doesn't come with like a very itchy nose. And I'm always like, I'm like bewitched, right? Except Tabitha, because she couldn't twinkle her nose, so she had to do this. So I'm Tabitha, constantly doing that.
Well, yeah, because they say that this Omicron variant is like the primary symptom is similar to allergies.
Yeah.
And so good grief. But when you always have allergies at this time of year,
yes,
and they're acting very similar to the allergies you always have, and then your allergy medicine just takes care of it.
Exactly. Or your allergy shots, like I got mine today.
Anyway, we digress.
Okay, so here we go. Mocktail margarita. So I again did cheat because I have HEB, and why not? So this is fresh squeezed lemonade, or you could get any type of lemonade. And this is fresh squeezed lime juice, and you could squeeze your own 1,000 limes to get all of this, because I don't know.
Oh, sorry.
I don't know how many limes it would actually take to get 16
lot.
fluid ounces of lime juice, but thank you, HEB.
Yes.
Shout out. And then here's the secret weird ingredient. It's pickle juice. Pickle juice gives you the little twangy twang that tequila does.
Hey.
So, all right.
I didn't even know that you could just buy it like that.
Yeah, isn't that weird?
Where'd you find that?
It's in the area where like Gatorade and all that is, because a lot of runners now.
Yeah. I use pickle juice, but I just drink the juice from the jar where the pickles were.
Yes. Well, yes.
Okay.
And after I bought that and we got home, and then Reagan was like, "Oh, I'm gonna have some little pickles," and she opened up this little thing. I was like, I could have just used the pickle juice from that, but oh well. Okay, so here's your favorite cup. Fill that halfway, barely halfway. You want me to do this?
No, I got it.
Okay, barely halfway with the lime juice. We want to, don't overdo the lime juice, because real lime, that's probably good right there. Real lime juice, oh, you know what? I'm sorry. Add a little more because we're making 2 drinks. I had only done it.
Wasn't halfway yet.
Okay, so we're gonna do that. And now we're gonna go, not quite to the top, but 2 of those of the lemonade. Yeah, I did the little taste test, but I only made it for 1, not for 2. Forgot about that.
Okay, not quite to the top.
Yeah, there
There's
we go.
one.
Uno. Y dos.
Dose.
Okay, now we're also gonna use some simple syrup. And we're gonna do not quite to the top yet. Again, all of our, and I did not plan this, but that pickle juice says pickle juice from Texas. And
Nice.
we're using our triple sec from Texas. Okay, and then pickle juice, we are going to use, it says 1/8 of a teaspoon
For 1 drink.
for 1 drink, so you're gonna do that twice.
All right.
So I just scooped and
Oh, it smells so good. I love pickle juice.
Okay, did I add all the ingredients? Yes, I did. Okay. Because earlier I left one in the mountain, I was like, that doesn't taste right.
Why do we have another measuring spoon?
Because I was using that for the triple sec and then I figured out the proportion. And I failed to take it away from the set.
Gotcha.
All right, I'm gonna do a quick shake. And we have already pre-rimmed our glasses with some mixture of salts.
Which, by the way,
Mhm.
I learned the other day that not everybody knows how to do that.
Oh, I should have done a
So
demo.
you get the rim wet.
I used the lime, I took the lime
Mhm.
and I rubbed it around the rim and then I flipped it over into the salt, which is,
Yeah, she's got one of the fancy things, but you could even just use a plate.
yeah, just a plate.
Now somebody asked me the other day how to do that.
Oh,
I was like, oh,
well, there you go.
shows what pros we are.
I just automatically thought everybody would do that. Apparently not. And so now we are gonna top this with tonic water. And again, we're using our favorite Fever Tree. So we're gonna give that a little topper. That's gonna give us a little fizz.
Yay.
It's making me happy so far. I'm trying to get the perfect pour like you do, but I never do. Okay, now
Well, you can read the shot glass and I can't, so we're good.
and then the one last thing, so I don't know if anybody's ever had a Mexican martini at Chewy's. It's basically a margarita with olives stuffed with jalapenos. So I'm going to drop a couple of olives in our drinks and a little bit of that jalapeno juice will roll out. Oh, that smelled good, by the way. Sorry, it's not smell-o-vision yet. A little squeezy here.
We really do need to find somebody that can help us make
Right.
that happen.
A little squeezy there. Drop that in.
Okay.
All right, dry January for some of you people.
I mean, we'll be filming again in January. I'm pretty sure it's not going to be mocktails.
No, but we had to do one for you.
Yeah, and get you started.
Right? Okay.
Cheers to beautiful smiles. You did a better job on my rim than yours.
See? Not bad.
No, it's not.
I feel like mine needs a little stirry like the tonic water sitting on
Yeah.
top.
Mm-hmm.
Okay. That's why I left that out so you could stir. Let me try this again.
Measuring spoon.
Oh yeah, that's better. Oh, that's way better. We just didn't stir.
That's yummy.
It is. I don't drink a whole lot of margaritas, but it's good. It's refreshing.
I do.
Well, you're not going to have a headache in the morning.
I'm not.
And you're welcome. Let's try. I could do with a couple more olives in there and a little bit of the olive juice as well. That'll be good. All right.
I'm going to drink this while you start talking.
So dry mouth. Again, it is cedar season. I mean, it is pollen season in Texas right now. And one of the biggest things that antihistamines do is they dry you up, right? They dry up all the snot, basically. Well, guess what? They also dry up all your saliva.
Yep.
So a lot of times in January, February, I'll have people come in and say, oh my gosh, my mouth is so dry and I don't know why. And then I begin to go through, first thing I do is, are you taking any antihistamines? But there are so many medications. Some of the top offenders are depression medications, high blood pressure medications, neuropathy medications, pain killers, the antihistamines. All of those cause decrease in salivary function.
I've actually gone so far as to tell my staff to just tell parents, if your kid is taking medication, their salivary flow is probably reduced.
Absolutely.
It's just a good rule of thumb.
I mean, it's crazy, but it's one of the side effects. And if you, whatever medication you're on, you just go ahead and you Google that medication and side effects, and I guarantee if you scroll down, dry mouth will probably be like number 2, 3, or 4 on that list, if not number 1. So other things that can cause dry mouth, obviously if you've had some cancer type treatment and you've had head and neck radiation, it can damage the salivary glands and slow down your salivary function. People that have had strokes have decreased salivary function. And then there's also autoimmune disorders. Sjogren's syndrome, I always say it wrong.
Sjogren's?
What?
Sjogren's syndrome?
Yes.
She can't say tipsy.
I can't say tipsy too talk, and I can't say Sjogren's. I've never been able to say that. Say it again. No, she can't.
Sjogren's.
There you go. That. So Sjogren's affects your eyes. So people will come in with dry eyes, and they also come in with dry mouth. And those people can have really severe cases of it to the point where their tongue is cracking. I know there's too much stuff.
Go ahead.
So long and short, there's so many things that can cause decreased salivary function. And so people are looking for the magic bullet. And I'm here to tell you there is not one. So far, nobody has come up with a pill to make saliva flow better, hasn't come up with anything that's going to give you long-lasting effects. All we can kind of do is help you kind of mitigate the effects by trying to tease your saliva glands into producing a little more, or coating your mouth with products. So one of the things that I tell people is pick up some sugar-free gum. Orbit, Trident, Eclipse, all of those, these are different. Sugar-free gums, they have xylitol in them. It's great cavity protection, but also as you chew, our salivary glands tend to begin to function and can give you a little more saliva, and people find some relief with that. And mainly for people that don't have some type of disorder that's causing it.
Like Sjogren's.
Like that. So the other thing, there is both Biotene and ACT make lozenges. And a lot of my older adults really love these because they can put it on their tongue, it kind of melts and it kind of coats their tongue, and especially if they're having a dry, cracked tongue, this is really soothing to them. So I picked up the ACT ones at our local HEB, but Biotene also makes that. Biotene's probably the #1 maker of dry mouth products right now, and they have a full line from toothpaste, sprays, the lozenges, the rinse. I just picked up some different samples of other stuff, but so Biotene oral rinse, this is also a great soothing rinse for you. It doesn't have alcohol in it, and that's one of the things that a lot of my patients will come in and say, well, I'm using Listerine, I'm using all these products trying to rinse my mouth. Stop, because the alcohol in all of those mouth rinses is just making you even drier. So you need to switch to something that's a lubricating mouthwash. So I do love the Biotene mouthwash. There's even some dry mouth toothpaste that have fluoride in them, because one of the things, our saliva acts as our natural mouthwash, and it neutralizes the acids that we consume, and when we don't have enough saliva to do that, then all that acid just sits on our teeth, and particularly along the gum line, causing root cavities, which are insane. They're hard to treat, they're hard to keep under control, and they move really quick. So dry mouth people always get my attention because I want to make sure that we want to identify what's causing it, and if we can't change the medication, then we start using something, and we're really diligent about keeping things clean, and maybe even seeing them on a more regular basis, maybe every 3 months instead of every 6 months, because root line cavities can move through a tooth in 6 weeks sometimes, and really cause some destruction.
And hydrate.
Hydrate. Water, water, water. Not sodas, not anything that has sugar in it. Don't drink coffee all day long. Caffeine also decreases your salivary flow.
I drink coffee all day long.
Okay, well, I will tell you my favorite product of all of these, particularly at night. So I have a lot of patients say, oh my gosh, I wake up at night and I'm like coughing, almost gagging because my mouth is so dry. You know, that cotton mouth feel after you've had a few non-mocktails. Biotene makes this spray, and I will say this is one of the handiest things. I tell people, when I tell them to get it, I say buy two. Put one in your purse, and put one on your bedside table, or put one at your office desk and one on your bedside table. One always goes on your bedside table, because when you wake up in the middle of the night and you're like, obviously you can have some water there, but water doesn't really, it'll help some, but this lubricating spray, instead of getting up and rinsing, or instead of getting up and popping a lozenge that now you have to worry about, don't fall back to sleep right away because I'll choke on it. You can just pick this up, squirt, squirt, swish it around, go right back to sleep. It's really good even for, I used to carry this when I was running.
Oh, really?
Because you know, you're running and you're breathing so hard through your mouth, and then all of a sudden you're like,
you feel like you're gonna die?
yeah, squirt, 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 squirt. So I always tell people to pick up a couple of these. Plus they're hard to find because they sell so quickly. So if you see them, don't just grab one, grab two. But I do love that. Some of the other things that cause dry mouth. I'm trying to think. I had
Just
a list.
regular mouth breathing. So
Yes.
people who, we've talked a lot about allergies, but the people whose front teeth are forward, and so when my face is at rest, meaning like I take a deep breath in through my nose and out through my mouth. When my face is at rest, my lips are together, but some people's aren't. Some people have to force their lips to shut, and so that means most of the time their lips are not together, and that's going to lead toward mouth breathing and dry mouth. When it's hard, it is hard to breathe through your nose with your mouth open. I don't know if I made somebody try it the other day, and because my staff was getting on this patient, like, use your nose to breathe, use your nose to breathe. I was like, you open your mouth and breathe through your nose. It's hard.
Yeah, that's hard.
It's really hard. So if your mouth is open, you're gonna tend to breathe through your mouth more. So people who have that lip posture that's out here, or they have a really long lower face, so their lips aren't quite long enough,
right.
You're gonna have a drier mouth, and so all these things will help with that as well.
People with sleep apnea too, because they're, you know, the snorers, their mouths are open, they're snoring, they're gonna have dry mouth. So there's a variety of reasons why it happens. Age can actually play a role in it. You know, as we age, our functions go down in many ways, and salivary glands is one of that. I also saw that people with Alzheimer's have a greater decrease in their salivary flow.
And that's before they're on meds?
That's before they're on meds.
What? Also, we didn't really talk about, you talked about cavities going up. It's also not good for your gums to be dry.
Yes.
Like, the texture of your gums will change and feel different, and it inhibits their ability to do their job the way they normally do it, and provide them with the nutrients that they need to support your teeth and your bones. And your mucosa, the lining of your mouth, how it's different than your skin, it's a surface that lots of things get through directly, and it absorbs things differently than the rest of your body, and you want to keep it moist so it's doing its job appropriately. You have salivary glands and stuff in your mucosa, so that also will play a role.
Yes. And I have patients that say, when I look in their mouth and I say, oh, do you suffer with dry mouth? Nope. I'm like, are you sure? No. Tell me some of the medications you're on. And then we start to talk about it, and then they ask, well, why do you think I have dry mouth? People that have, oh, guys, sorry. That have thick, ropey saliva, like those people that you see that sometimes the saliva is kind of sitting right on their lip because it's so thick that it kind of rolls. People that have, say, gosh, you know, and obviously during COVID times, this is, you know, weird, but they have a change in their taste because their tongue is so dry that it's affecting their taste buds. People that suddenly have like a cough because they're dry and they just can't get the saliva, and then they begin to choke a little bit. So many reasons why, or symptoms of dry mouth that people don't necessarily associate with it being dry mouth.
Yeah.
So, but a lot of these products easily found, you know, for my working people, I always tell them, you know, gum's a great one to have, or the Biotene spray at your desk. When you're at home, you can use any of these products. The lozenges work really well. The toothpaste is great, and it's got fluoride in it. The rinse, some people really prefer that because they like to brush and floss and then use this rinse in place of their alcohol mouthwash. And then highly recommend the spray by your bed and water by your bed. And then again, if you're gonna have a beverage throughout the day, please make it water. Water, water, water.
Yay.
So, well, I think
Yes,
our
ma'am.
mocktails were a success.
They were. I drank mine.
Oh, well, now you have to cheers with.
I
maybe
got
not
a little sip in there.
Okay. Well, okay. I hope you enjoyed the mocktails. Dry January for some of you.
Thanks so much for joining us again, and
All right.
cheers to beautiful smiles.